Hello, my name is Dr. Rob Koontz with Conley and Koontz Equine Hospital, and I'd like to help you better understand equine emergencies, what they look like, when you should reach out for help, and Nevaeh will be helping me today asking some common questions horse owners have about emergency situations.
Dr. Koontz, how do I find an emergency veterinarian for my horse?
The best time to plan for emergency is before one happens. First, and most importantly, you should have a relationship with your equine veterinarian so that your veterinarian knows you and your horse. Having that relationship between a horse owner and a veterinarian gives horse owners the knowledge of whom they should call, how to reach out to them, and what their emergency options are ahead of time. At Conley and Koontz, we provide emergency service and guidance when your horse needs it most. We recommend saving our number in your phone and knowing how to reach us after hours. Having a clear plan in place can save critical time and reduce stress during an emergency.
How do I know if my horse is experiencing an emergency?
A good rule of thumb is if your horse is acting significantly different than normal, that's a reason to be concerned. Sudden pain, distress, difficulty standing, heavy bleeding, or rapid changes in behavior can all signal emergency. Knowing your horse's baseline temperature, heart rate, and respiratory rate is important so that you will know if these vital measurements have changed. If you're ever unsure, we encourage you to call Conley and Koontz Equine Hospital. We would much rather help you clearly see a condition than let it worsen.
Is my horse being lame an emergency?
Not all lamenesses are emergencies, but sudden or severe lameness can be. If your horse will not bear weight on a leg, shows intense pain, or if you notice swelling, heat, or a wound, that should be evaluated promptly. When lameness comes on quickly or is accompanied by signs of infection or severe discomfort, contacting Conley and Koontz Equine Hospital is important.
What are some signs and symptoms that are considered an equine emergency?
Well, wounds, deep wounds, uncontrolled bleeding, puncture wounds, or wounds near joints and tendons are all considered emergency. Even wounds that look very, very small on the surface can be very serious underneath, which is why early evaluation by Conley and Koontz Equine Hospital is critical. Colic is another emergency. Colic is one of the most common causes of equine emergencies and should be taken seriously. What colic means is abdominal pain. And signs of colic include pawing, looking at the flank, repeatedly laying down and getting up, rolling, decreased appetite, or reduced manure production. Even mild signs can progress quickly, so if you suspect colic, contact Conley and Koontz Equine Hospital as soon as possible. Another emergency situation is a choke. And a choke is a bad name because the horse can breathe just fine. What we consider a choke in the equine world is an esophageal blockage or a blockage in the tube that goes from the mouth to the stomach, not an airway blockage. But when choke occurs, food becomes lodged in the esophagus and is considered an emergency. Common signs include difficult swallowing, coughing, feed or saliva coming from the nostrils, stretching of the neck, and signs of distress. If you suspect choke, remove all feed and water and contact Conley and Koontz Equine Hospital immediately for further instructions. Hoof injuries can be an emergency. A sudden severe hoof pain or horse that won't bear weight may indicate a hoof abscess or an injury. While some hoof abscesses are manageable, intense pain or worsening signs should prompt a call to Conley and Koontz Equine Hospital.
Should I give my horse first aid at home, and what should I have in my first aid kit?
Basic first aid can be helpful while you're waiting for veterinary care, but it should never replace professional treatment. A well-stocked equine first aid kit should include clean bandage materials, aseptic solution, gauze, a thermometer, and a hoof pick. Knowing how to safely take your horse's temperature, heart rate, and respiration is also important. Before giving any medications, we recommend calling Conley and Koontz Equine Hospital for guidance.
How will a veterinarian treat my horse in an emergency situation?
Emergency treatment is focused first on stabilizing your horse and controlling pain. Depending on the situation, this may include medications, wound care, diagnostics, or advanced treatment, either on the farm or at the hospital. At Conley and Koontz Equine Hospital, our goal is to provide timely, skilled care while keeping your horse as comfortable and safe as possible.
Is active labor considered an emergency for my horse?
Normal foaling is not an emergency, but abnormal or prolonged labor absolutely is. Abnormal labor is called dystocia. If a mare is actively straining for more than 20 to 30 minutes without progress, if the foal appears malpositioned, or if the mare seems distressed, this is an emergency. In a normal delivery, the foal will come out a little bit with each uterine contraction. The foal will then fall back into the uterus slightly between contractions when the uterus relaxes. If the mare and foal are making progress with each contraction, then that's probably a normal delivery. However, if the uterus is contracting and the mare and foal are not making progress, it is likely an emergency. In those cases, you should contact Conley and Koontz Equine Hospital immediately. If your mare is in foal, you should have transportation ready and be prepared to get your mare to the hospital as quickly as possible. In most cases, very little can be done for dystocia on the farm, and intervention at the hospital is required. Early intervention can be life-saving for both mare and foal.
Will my veterinarian come to me in case of an emergency?
Many emergencies can be addressed at the farm, while others are best treated in a hospital setting. At Conley and Koontz Equine Hospital, we will help determine the safest and most efficient plan for your horse, whether that means a farm call or transport to our facility for advanced care. That's why having an established relationship with our team before an emergency occurs is very, very important. If you ever have questions or concerns about an emergency involving your horse, call Conley and Koontz Equine Hospital. We're here to help. We have specialists every step of the way.